head-to-toe assessment for our finals in health assessment. So first what we have to do is to ask a patient and provide privacy for the patient. So, good morning, good afternoon, I mean. My name is Angeline Taghap and I'm going to perform a head-to-toe assessment with you. Is that okay with you? Yes. Okay, now she agreed. So we will gonna proceed. So, what's your name, please?
I'm just Maria.
Age?
19.
And your birthday?
October 22.
Okay, now you got the personal information of your patient. You confirm your patient, and now we're gonna ask a further question if we will know if she is aware or conscious about what's happening in the surroundings. So, what's 1 plus 1?
2.
Where are we at now?
Skills laboratory.
And are you aware of what we're gonna do today? Okay, and that's it. So now we will proceed to taking the vital signs. First, what we will be going to do is to take the temperature of the patient. And also, we are not here, so we should also take the respiratory and pulse.
Peace.
So the temperature is 36.7 degrees Celsius and your spirit and your pulse is 63 beats per minute.
Play.
So okay, that's it, and now we will proceed to taking the BP. Okay, so your blood pressure is 120/90. It's normal. And now, after we take the BP, we will proceed to taking the height and weight. And before we do that, we should go and take note of it. Okay, shall we proceed? Step. Okay. Ingon ba? So your weight is 124 pounds. And and your height is
Every patient is black
155.
with a partially white hair. And the head is rounded, normocephalic, and symmetrical.
And now I'm going to do the head assessment. First, I will inspect his head and then palpate. I'm looking for any lumps, lesions, and tenderness. Here we go. Now I'm going to palpate his temporal artery and temporomandibular joint. Say ah. Go. Pinch. I'm going to assess his facial sensation. Okay. And now I'm going to orient his facial expression. So, sir, would you smile for me, please? Frown. Puff up your cheeks. Show your teeth. Raise your eyebrows. And then tightly close your eyes. Okay. That's it. Thank you.
The eyebrows are equally distributed. The pupils are round and symmetrical. The cornea is
Sclera is white and clear. And then this is trial. And then the lower lid is pink. They're pinkish. And there's no
The
sign of any
pupils are
lesion
equally
or
round,
edema.
respond to a light accommodation, and when it is illuminated, it constricts.
Go.
And now I'm going to assess for the cranial nerve 3, 4, and 6. So that. Mana?
2, 1, 3, 3,
When assessing the
Four.
peripheral visual field, the client can see objects in the periphery when looking straight ahead.
5, 2, 4, 3,
Now I'm going to assess the patient's visual acuity using the Snellen chart.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, F, O, D, P, C, P, F, B, P, L, T, C, E, O, E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, F, O, D, P, C, D, F, D, P, L, T, C, E, O.
So it concludes that the patient has 20/20 vision. So now we will move on to his ears. So first I will inspect and then palpate his ears.
So first, then palpate.
So as you can see, there's no signs of lesions, tenderness, or redness. Now I'm going to check his ears
There
inside
are
of his
no
ears
any
using
signs
pen light.
of lesions, swelling, and tender.
And now I'm going to perform Renee's and Weber's test. Okay. And now I'm going to proceed in the whisper test.
The patient is able to hear the words that I've said.
Orange.
The nose is aligned center, straight, uniform in color, and the patient is able to breathe without difficulty.
Now I'm going to assess the patient's nose. So first, and now I'm going to palpate his nose and sinus. Now I'm going to
Masses,
check inside
tenderness,
his
and
nostril.
lesions. Lips of the client are uniformly pink, moist, symmetric,
There's
and
no
have
any-
smooth texture.
And now I'm going to assess his mouth. First, I will inspect his mouth using tongue depressor. Where's the
Patient has 32 adult teeth. There is a little discoloration due to the cavity and decayed molars.
And now I'm going to perform taste test to assess his cranial number 7 and 9. First, can you close your eyes, please?
Bitter. Coffee.
Okay. Very good. And then, wait.
Sour.
And then, last one.
Sweet.
It includes that he tastes the foods correctly and the cranial nerves is intact.
The neck is in uniform color and it is positioned at the midline.
And now I'm going to assess his neck and shoulder. So first, I will gonna check the neck range of motion. So we just tilt here, and up, and down.
It is coordinated and smooth movement with no discomfort. The patient is able to shrug against my resistance.
Next, I'm going to palpate his lymph nodes.
The patient's lymph nodes are not palpable and it is not inflamed.
Now I'm going to palpate the trachea.
During the palpation of trachea, there's no inner lumps and lesions that I've observed.
Now I'm going to palpate and auscultate the carotid artery, and it should be palpable. Carotid artery is palpable and it is 2+. Next, I'm going to assess his hands and arms. But first, let me check the range of motions of his arms and hands. So, widespread, up, down, and up.
The patient is able to move without discomfortation.
Next, I'm going to check the range of motion of elbows. The elbows are able to reflexes without discomfort. Next, I'm going to palpate the brachial and the radial pulse. Plus 2. And now I'm going to assess the range of motion of the wrist, and I will see if there's no discomfort on the deformities.
The patient's hand can move alternately with rapid space.
Next, I'm gonna do the capillary test on his fingernails and do the skin preview.
The patient has good skin texture.
What we're gonna to do is to assess the sharp and dullness on the arm. Okay. How do you feel? Yes. Those were. Next, I'm gonna assess the reflections of his biceps and wrist. Next, I'm going to inspect and auscultate the exterior of the lungs.
During the auscultation, I hear no bruits or wheezes.
Next, I'm going to inspect, palpate, and auscultate the heart. So there's no any masses.
The abdomen of the patient is uniform in color, symmetrical in contour, and not distended, and has a little body hair under the umbilicus.
Next, I'm going to inspect and then auscultate the abdomen and then palpate. And then I'm going to palpate the abdomen. And now I'm going to assess the leg and feet of the patient. So first, I'm going to do the range of motion of his feet.
The patient is able to move his knees and foot without discomfortation.
I'm going to assess the reflections of his legs. And also for his ankle.
His toe is in uniform color and there's no sign of any masses and lesions.
Now I'm going to check the capillary refill of his two fingernails.
When the nails pressed, the nails return to usual color in less than 4 seconds.
So next I'm going to palpate the pulse of his feet. 2 plus. Pababa. Good. And also good. Next, I'm going to assess the sharp and dullness sensation of his feet.
Naa. Naa.
The patient is able to feel the sensation of his feet.
Naa.
While assessing the gait, he has posture and steady gait with a pausing arm swing unaided and maintaining balance. While doing the heel-toe walking, he maintains heel-toe walking along a straight line.
Next, I'm going to check his musculoskeletal if there is a sign of scoliosis. So then,
The last one on the